Hormone replacement therapy can be a game changer for midlife women, but there are some very common mistakes that I frequently see watering down the positive effects of hormone replacement therapy for women. Let's talk about 10 of them so that you're able to make a plan for you that will give you all the benefits that matter to you. You're listening to the Health Courage Collective podcast, episode 219, 10 Hormone Replacement Therapy Mistakes. Welcome to the Health Courage Collective podcast, the show for women who are too busy to slog through hours of generalized, inapplicable, and often contradictory health information, but too smart to ignore that a few minutes of focused attention now can prevent years of suffering in the future. I'm your host, Christina Hackett, a pharmacist who doesn't want you to live on prescriptions, a certified coach specifically trained to maximize your potential, and a compulsive learner obsessed with preventative, cutting-edge, holistic, and integrative medicine. I'm on a mission to increase your physical and mental resilience so you can fearlessly look forward to your next 40-plus limitless years. Your time is now. Let's go. Hello, and welcome to today's episode. I'm so happy that you're here today, as always. I hope that you've had a lovely September week. Was it helpful to know some reasons why it's so hard to find a good medical provider to help you with midlife hormone issues? I don't know if it makes it easier, but I think that sometimes understanding the issues helps you move forward better. Today, we're talking about 10 hormone replacement therapy mistakes. This is definitely not standard of care medicine. It's my opinion about the things that most standard care providers do wrong. So know that it is for sure controversial. My opinion is my own, but it's based on a ton of reading and research and discussions and experience with patients. But I know that it differs from the mainstream opinion. I just hope that it can help you think about things in a way that helps you decide what your opinion is. Totally fine if it's different from mine. My first opinion is that it's ridiculous that this even needs to be a matter of opinion at all. It should just be a matter of scientific fact. But unfortunately, that's not the way things work in our current medical system most of the time. So I started out thinking I would just list some things that I think people do wrong with hormone replacement, then go back and fill in the details, and that would be it, which I did. But as I filled out the reasoning for each one, I realized there really aren't 10 things. It's really just one thing. It took me going through all of them to come to that realization. So I hope it's still worth it to you to hear each of them too. But know that it really all boils down to one thing that I think prescribers and patients get wrong. And it really is a matter of opinion. So you decide what you think and what you want to do with your one wild and precious life, as they say. And that one decision will make all of these 10 aspects easier and more of a no-brainer. So the first one on my list is kind of silly, but tons of people still get this wrong. It's to say that hormone replacement therapy for midlife women is dangerous and scary and should be avoided if at all possible. And this one isn't a matter of opinion. This is a scientific fact. Appropriate hormone replacement therapy isn't something that puts you at increased risk for breast cancer or heart disease. It's not a matter of having to make the decision, is my suffering horrific enough to warrant putting myself at increased risk of major diseases? Yes, there might be things to consider for specific women with specific conditions, but overall, at the general population level, hormone replacement therapy helps prevent and delay almost all of the chronic diseases of aging, including breast cancer and heart disease. It doesn't increase them. Okay, my second item is something that is shouted far and wide about hormone replacement therapy. Use the lowest possible dose. While the idea that all hormone replacement therapy is uber risky and you'd be out of your mind for even considering it is fortunately slowly melting away as people pull their heads out of the ground, let's say, the idea that you need to use the absolute lowest possible dose is still pretty widespread. The main thing taught by most authorities is that sometimes it might be okay to use estrogen, but for sure, only ever use the lowest dose you can possibly get away with. Not to go on a huge tangent here, but my parents were in their 40s when they had me, so I'm way younger than all of my cousins, and my grandma Edna died before I was born. From the many, many stories I've heard about her, she was an interesting character to say the least. She probably had bipolar disorder, but it wasn't something that was evaluated or diagnosed back then. Anyway, sometimes she was super fun to be around, and sometimes she was the scariest person on the face of the earth. And apparently she thought it was really rude to ask to use someone's bathroom when you visited their house. That was a thing to her. So one time my aunt brought her 4 or 5-year-old daughter to visit her interesting mother, not knowing which version of her they would get that day. And she made sure to tell her little girl that she was not allowed to ask to use the bathroom. Then at some point before they were getting ready to leave, it became obvious to my aunt, in that way that mothers of 5-year-olds can tell from how they squirm, that her daughter needed to go to the bathroom or there would soon be an accident. So she asked if she could use the bathroom, which was a scary question to ask, went in, came back out. It was all fine. Grandma Edna didn't even mind. They finished their visit with some relief, and then when they got in the car to drive home, the little girl was squirming all over the place again. And my aunt asked her, "How can you need to go to the bathroom again already? You just went like 10 minutes ago." And my little cousin proudly told her, "Don't worry, Mommy. I only went a little bit." This is my crazy family. But it totally reminds me of this. I feel like everyone's saying, okay, your body is clearly crying out for estrogen, and we've been told it's not okay to replace it for so long. Now that it's becoming clear that we were really wrong about all of that, it's okay to replace it, but only a little bit. Don't worry, Mommy, I only went a little bit. It's equally silly. Okay, replace it, but not to a level that's beneficial to every cell in your body, only to the level that takes the edge off the most unbearable effects, and no more. The third mistake on my list is very similar. The second part of the phrase lowest possible dose is shortest possible duration. What's very widely taught is to only provide hormone replacement for a few months or a year or 2 at the most to get through the most disruptive parts of the menopausal transition. Again, it's coming from the mindset that hormone replacement therapy is inherently dangerous, and the goal is to take the edge off the worst symptoms, not to maximize quality of life and improve health span by giving your biology the tools it needs to prevent or drastically delay all of the common diseases of aging, including cardiovascular disease, cancer, dementia, metabolic dysfunction like type 2 diabetes, chronic pain, frozen shoulder, osteoporosis, irritable bowel syndrome, decreased immune system function, and on and on. How long you want to stay on hormone replacement therapy, if at all, should be up to you and your vision for your future and what you want to do with your life, and it should not be based on unscientific, thoughtless fear. The fourth mistake on my list is what is also proclaimed by the so-called menopause experts. Hormones can be used at the smallest possible dose for the shortest possible duration, only to treat symptoms of menopause that can't be alleviated any other way. And that is its only benefit or reason for use. The only possible reason you should consider starting hormone replacement is if your symptoms are so bad you can't see any other options. And the only benefit they will give you is a reduction in those symptoms. That's it. Who gives a crap about your whole body health and massively increased risk for hundreds or thousands of other problems related to low estrogen, progesterone, testosterone, and DHEA? Why opt out of the perimenopause roller coaster with an intelligent hormone replacement plan when you can just wait till you're desperately miserable, then try to take the edge off with a small, brief hormone prescription and a lot of recommendations to eat more greens and sleep better? My fifth opinion about what providers get wrong is something else commonly recommended by traditional experts, that there is no reason for hormone testing. It does kind of make sense if your opinion is that hormones should only ever be used to treat uncontrollable symptoms, and your plan is to use the lowest possible dose for the shortest possible duration. Then sure, testing isn't necessarily useful. And it is true that for many women during perimenopause, you could do the same test a few times, a few days apart, and one day your hormones, estrogen in particular, would be really low, and the next day really high. So that does make testing tricky, but not worthless in my opinion. It can still give us a lot of good data. The other tricky part is getting a provider who knows what they're doing. We talked about how hard that can be just last week. Blood tests measure the amount of both free and bound hormones, and they aren't helpful for evaluating symptoms or adjusting the doses of topically applied hormone replacement prescriptions. There are also salivary tests and urinary tests and blood spot tests. Urine testing only measures downstream metabolites, so while some doctors swear by it, others don't rely on it for adjusting doses. The Dutch urine test definitely gives you a ton of valuable data, including how you metabolize estrogen, which is very valuable to know because there are some metabolites that can signal that you're at higher risk for some problems, including cancer. It's something you want to know about. Some doctors prefer salivary testing, which measures bioavailable unbound hormone levels. While you don't want to treat lab levels, you want to treat the woman, I think completely ignoring the tool of testing is a big mistake. And you don't just want to test for estrogen. You need to know about all 3 types of estrogen: progesterone, testosterone, sex hormone binding globulin, DHEA, cortisol, insulin, melatonin, and comprehensive thyroid function. But only if you want all the cells in your body to have what they need to function optimally for decades to come. All right, number 6. I had an awesome professor in pharmacy school who would often say that what separates man from beast is man's insatiable desire to take a pill. It's definitely the easiest way to take a drug, and there are cheap, easy oral estrogen tablets available at any pharmacy with a prescription from your doctor. But I'm not a fan of taking oral hormones. So if that's what your doctor recommends, be hesitant and a little skeptical. Do a little more research. Except for progesterone. So, the reason why lots of drugs and hormones can't be taken orally is because we have an amazing liver that does so many crazily awesome things that I can't even fathom. Your liver is freaking amazing. Be grateful for it. One of which is metabolize many things we take orally into altered or inactivated forms. Nobody would ever prescribe oral testosterone because it will not work. Estrogen, quote unquote, works orally, but is still metabolized by the liver, and those metabolites change some of estrogen's effects, like increasing your risk for blood clots. I think topical estrogen is just a better way to go, like a cream or a patch. It's tempting to just prescribe oral estrogen tablets if you don't really know how to prescribe hormone replacement, but I don't think that it's optimal. Progesterone also gets metabolized in your liver when taken orally, but one of those metabolites, allopregnanolone, is really good at helping you sleep. So that's one that might be purposefully given orally at bedtime because it's going to help you sleep. So it's really just oral estrogen to be wary of. Or I guess if your doctor told you to take oral testosterone, then you know that they're a real moron. The 7th thing on my list is one of my biggest soapboxes. It's commonly taught that hormone replacement therapy is estrogen replacement, and that the only reason to take progesterone is because if you still have your uterus and you take estrogen, you'll dramatically increase your risk of endometrial cancer. It is true that if you have a uterus and you take estrogen only, you'll dramatically increase your risk of endometrial cancer, which you don't want to do, obviously, because estrogen is proliferative, and it's what tells your uterine lining to thicken up in preparation to receive and nourish a fertilized egg. But there's way, way, way more to progesterone than just preventing you from getting endometrial cancer during estrogen replacement. Progesterone needs to be in balance with estrogen because it's how your body is designed to work. You need an appropriate balance of all of your hormones, and progesterone needs to be there to balance out the presence of estrogen, whether you still have a uterus or not. Progesterone is super good for your brain. It helps protect against other cancers than just endometrial cancer. It's essential to your thyroid gland, your hypothalamus gland, and your adrenal glands. It decreases inflammation and it helps you balance your immune system, helping your immune system not be too overactive or underactive. Progesterone helps reduce anxiety, depression, and chronic pain. So if your doctor says that progesterone is only useful if you want to take estrogen and still have a uterus, tell him he's wrong. And don't accept an estrogen prescription without a balanced dose of progesterone. Okay, number 8. Now we're getting a little more out there. This is definitely not mainstream. I believe it to be true, but it's definitely not the standard of practice. Not even something that most women or their prescribers even really consider, so I hope that you'll consider it. Doesn't mean you have to go this route, but I think it's worth having a think about. It could maybe make your life way better. Taking the same dose of hormones every day. That's very standard. Put your estrogen patch on and it will deliver a steady dose of estrogen through your skin all day, every day for 3.5 or 7 days, depending on which patch you get. Take your progesterone capsule every night if you still have a uterus, so you don't get endometrial cancer from your estrogen replacement. The end. That's nice, but if our goal with hormone replacement is not just to take the edge off our worst symptoms, but to help our cells and organs be biologically younger than our chronological age, then we want to provide our cells with the resources they had when they were chronologically younger. When we're in good health in our 20s and 30s, our hormone levels are not the same every day. Our estrogen is pretty low for the first 7-ish days of our cycle, climbs up to a peak at approximately day 14, then decreases, then bumps up again to a lesser degree around day 21, then falls again. Our progesterone is pretty low till around day 17, then goes way up and stays way up until around day 27. The dramatic fall of progesterone is what triggers menstrual bleeding. Testosterone also fluctuates a bit with an increase around days 12 to 16 and slightly different levels at the beginning versus end of the month, but it's a lot more subtle. The point is, while replacing the estrogen, progesterone, and possibly testosterone and DHEA our bodies are crying out for can be good, replacing them the way they were naturally created to be produced at cyclical levels throughout the month is even better. This could be a whole topic all on its own. Send me a message at healthcouragecollective@gmail.com if you want to learn more about it. But you're mimicking a younger and more natural physiology when you dose your hormones this way, which I think results in more benefits to your overall health than just keeping a steady state all the time. I've been spending a lot of time researching a gene called TP53 that encodes for a tumor suppressor protein called P53. Maybe I'll share more with you soon, but it's been pretty hard for me to wrap my head around. It's not simple. The short version is that P53 repairs DNA and regulates cell division, keeping cells from dividing like crazy and becoming cancerous. P53 is specifically stimulated by the rhythmic peaks and troughs of estrogen and progesterone during a monthly menstrual cycle. The loss of those rhythmic peaks and troughs reduces functionality of P53, increasing risk of all kinds of cancer, including breast cancer. We don't definitively know a ton about it, but I think it's one of many indicators that while a bit of steady estrogen and progesterone helps somewhat for a while, our bodies are made to thrive in 28-day cycles of daily changes. So why not give them every opportunity to stay biologically younger? The ninth thing I think a lot of people get wrong with hormone replacement therapy is not starting soon enough. Our hormone levels start to naturally decline in our 40s usually, and there are several years of getting ready to stop releasing eggs before the symptoms of hormonal decline get unbearable. Most women don't ask for help until they feel pretty miserable, and if they did ask for hormonal help earlier, they'd most likely be told to wait until things get worse. So that's pretty stupid. Chances are pretty good that your doctor is not going to ask you about or encourage you to make a proactive plan for what you want your perimenopause/menopause transition to be like. If she does, stay with her forever and tell everyone you know about how wonderful she is. Otherwise, it's going to be up to you to decide what you're going to want to lean toward. That's why listening to a podcast like this every week tells me that you are splendidly smart and on track to have a better biological future than most women. Planning ahead and knowing what you think about different health philosophies helps so much when it comes time to decide what to do. There is kind of a hormone replacement window of opportunity where if you're more than 10 years past menopause, starting hormones for the first time might not be the best move for you. Unless we're just talking about vaginal estrogen, do that. Regular hormone replacement isn't totally off the table, but you'll definitely get the best results, most effective symptom management, and best long-term health span improvement by starting during perimenopause, before you have really significantly disruptive symptoms. Working your way back from feeling truly awful is a lot harder than preventing that crash to the best of your abilities ahead of time. This brings up the question of whether you for sure want to take hormone replacement once your body isn't producing optimal young person levels of hormones anymore, or if you want to wait it out and see what happens and go without if possible. Totally up to you to decide what resources you want to provide your physiology and in what way. Okay, my last thing that I see so often that I think is a mistake is telling women testosterone is only for sexual symptoms and/or the only thing that makes a difference for sexual symptoms. The second part of that maybe confusing thing that I just said is that when doctors who are open to prescribing hormones for women hear about her having low desire or low pleasure with sex, they'll often just focus on testosterone. Testosterone is important for that stuff. They are right about that, but so are estrogen and progesterone. So that's what I meant by that. Testosterone's not the only player in that game. All hormones have to be in balance for good sexual function. The first part of what I said is that a lot of doctors only prescribe testosterone for women who are having low sex drive type symptoms and think that it's not really good for anything else. But they're wrong. Good hormone replacement therapy is about estrogen, progesterone, and testosterone because they all work together in our bodies to signal all of our cells and organs and neurotransmitters to do their best work. Our total testosterone levels are actually higher than that of our estrogen levels. Did you know that? A normal estrogen level is like 1 to 200 picograms per milliliter of blood, but a normal testosterone level is 200 to 400 picograms per milliliter of blood. Still, much, much less than men, but more total testosterone than estrogen running around your body. I think that's interesting. Anyhow, if you want optimal muscle mass, energy, bone density, and mental health, you want optimal levels of testosterone. It's not only for sexual symptoms. Okay, so that's it for my top 10 list of things I think most people get wrong with hormone replacement therapy. If I were to have an 11th thing, it would be using synthetic hormones. I don't see it too often anymore, thankfully, but if your doctor recommends Premarin, Provera, medroxyprogesterone acetate, methyltestosterone, Estratest, Femring, or birth control pills as your form of hormone replacement, just say no. Luckily, there are quite a few bioidentical hormone options like estrogen patches and progesterone capsules nowadays, in addition to compounded hormones, so it's not as big of a problem as it used to be. It used to be that if you had diabetes, they'd give you pork insulin because that's all there was. Nowadays, it would be absolutely insane to give someone pork insulin when human insulin is an option. But some doctors still recommend horse estrogen instead of human estrogen. Not as much, but many of them still think synthetic progestins are fine. They are not fine. Okay, that's it. I hope those 10 things are helpful to you as you come up with an intelligent plan for how you want to age, especially in regard to your hormone health. Did you recognize the thread that ties all of these things that are mistakes, in my opinion, together? In the book, The Great Menopause Myth, that's a good one, I like how Kristen and Maria, the authors, say that we all believe that our hormone levels decline because we get old. I've always believed that. What about you? But what if we get old because our hormone levels decline? Interesting. Obviously, I know it's not the only factor at play, but I do think it's one that's easier to control, and I see the benefits in the lives of patients I see every day. We do all kinds of medications at my pharmacy, and the difference in the patients who proactively choose a bit of an alternative path and the ones who reactively follow the standard of care is shocking. Shocking. All of this is to say that rather than having to remember all 10 of these things, what really matters is the reason you have for replacing your hormones when they decline. If the only reason you might want to do so is because you're suffering from a myriad of symptoms, then it makes sense that you do so by taking the lowest possible dose for the shortest possible duration, not testing it out any levels, taking the easiest thing to prescribe, like oral estrogen tablets, taking the same dose every day, and not starting till you feel pretty bad. I was listening to an interview the other day of a doctor who co-authored a book called Estrogen Matters, which I haven't read yet. His name is Dr. Avram Blooming. He said he welcomes debates about hormone replacement and he loves discussions and deep thinking. And one time he was on stage with some other doctors scientifically and respectively defending his views that they did not agree with. And one of his opponents, so to speak, got exasperated and said, "Okay, well, yeah, I guess if all you care about is looking better, feeling better, and living longer, then you should take estrogen." Pretty funny. But it makes the point well that if your reason for taking hormone replacement is to give your body the ingredients that help all of your cells and organ systems to age more slowly, and thus prevent or drastically delay all of the common diseases that are most likely to make you stop living before you die, then those 10 things most people get wrong will be way easier to avoid. You'll be proactively reducing your risk for most of the medical problems that plague most women in the Western world, while simultaneously opting out of perimenopause to a certain extent. Thank you so much for being here today. You are fantastic. I hope this gave you some things to think about that will help you on your journey to live more as you get older rather than less. Do it your way, no matter what my opinion or anyone else's opinion is. Next week, we're going to talk about my favorite thing, control. Until then, don't make the 10 hormone replacement therapy mistakes and don't be normal. Thank you so much for tuning into the Health Courage Collective podcast. I am truly honored that you have paid me the enormous compliment of your time and attention. I would be so grateful if you would share this podcast with someone you know and subscribe so you never miss an episode. This podcast is for entertainment and information purposes only. Statements and views on this podcast are not medical advice. This podcast, including Christina Hackett and producers, disclaim responsibility for any possible adverse events by use of information contained herein. If you think you have a medical problem, consult a licensed